Welcome to the Health Update. I'm Madison Kasper. With me is Dr. Aarti Raja, Mako Media's Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison.
Our topic today is the rise in cancer diagnoses for young adults. Dr. Raja, as young adults, cancer isn't really part of our reality as much or in our minds. So what are studies showing about it?
So what studies are showing currently is that they're noticing that the incidence of cancer cancer is appearing in a younger and younger generation. So usually people always assume that you would get a cancer diagnosis perhaps when you're 50 and above or 60 and above, depending on the type of cancer. But what they're noticing is some cancers are beginning to show up in adults who are even in their 20s or perhaps 30s. So that seems like a little early to be noticing a disease like cancer.
What types of cancers are showing rises for younger adults?
So some of the cancers that are showing up at an earlier age are things like colorectal cancer, some breast cancer, some pancreatic cancer, and these things are being seen in a younger population.
What role does diet and lifestyle play in this?
So there is some research that is pointing out that maybe the way our food is being produced now has changed compared to maybe 30, 40 years ago. Maybe the type of jobs we're partaking in has also changed. We're maybe leading a little bit more of a sedentary lifestyle where we're sitting down more than being physically active. So maybe these are some issues, but research hasn't completely shown one versus the other, or that one is causing the problem with the rise in cancer at an earlier age.
How does cancer diagnosis affect someone's life?
If someone gets a diagnosis of cancer in their 20s, somewhere between 20s to 40s, that can be quite devastating because normally, as you pointed out up front, that is the age time when people aren't really thinking about health and disease conditions. That is when people are beginning to live their lives, they're embarking on their first job perhaps, they're maybe looking for a life partner, they're pretty much like setting up their life. And to get struck with a diagnosis like cancer can really be a game changer because there are many side effects that come with treatment of cancer. So in some cases, it may not necessarily be a bad thing to catch it early. In fact, it could help with therapeutics. You could treat it better if caught earlier. However, a lot of the therapeutics have a lot of side effects. People can undergo, it has an impact on things like childbearing, whether a man or woman. So, and in that age frame between 20s to 40s is when people are thinking about these kind of things.
What are some common treatments?
It varies with the type of cancer or sometimes even surgery to remove the tumor if it is a solid tumor and if it's in one location and it hasn't spread yet. So there are multiple therapeutics available for multiple cancers, but the biggest thing being diagnosing it early so that one can decide what treatment makes sense for that individual, because treatment has to be catered to the individual.
Any last thoughts?
Getting a diagnosis of cancer or finding out that maybe you have this indication, as devastating as that can be, one of the things to remember is not to panic. Of course, it is easier said than done coming from someone who probably isn't dealing with it. But what is important to remember is to go about it the right way. Speak to the right people, speak to the physician, get all the information. There is a plethora of information out there right now, but what I would tell every student or not is to obtain the information from the right person. Be aware of all that is out there. Talk to doctors, talk to the family, talk to friends and family, and then it becomes easier to handle this. It can be an issue, but in this day and age, we have a lot of information available. There are a lot of good therapeutics available as well. So the key would be to get informed from the right sources, go to the right places, gather the information, and then meet with it head on.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.